Well, good afternoon. Hey, I'm Dr. Bill Christenberry at Caldwell Mill Animal Clinic, and today we're going to talk about skin growths, skin tumors, bumps, lumps that you find on your pet, and how we deal with those and what we do about them. The thing about the skin growths that pets get on their skin is, we as humans get growths on our skin as we age, but we have an average lifespan of 76 years. A dog and a cat has an average lifespan of somewhere around 12 or 14 years, and so they pack a lot of illnesses and lumps and bumps and growths into a shorter period of time, and so you tend to see more of them, and they come up quicker than what we would expect. So some of the things that we look at when we're looking at growths and tumors on pet skin is we want to know about the duration, how long they've been there, if they changed in a certain period of time, what the character of it is. Is it under the skin or is it on top of the skin? Does it have hair growth on it? Does it not have hair growth on it? And then we consider the pet, the age of the pet, because we see certain growths at certain ages, histiocytomas in younger pets, and other growths, perianal adenomas, as they get older, just as an example. Consider the breed of the pet. Certain breeds of dogs and cats get certain types of growths and other dogs don't. And their gender. Males and females sometimes get different types of skin tumors. So we'll look at that as well. So when their pet comes in and we look at a growth like that, we'll ask those questions, look at those different things. And then we can, a lot of growths, you can look at them and you know pretty well what they are because if we've been looking at them for 20 or 30 years in our experience, you come to know what one looks like and are able to identify that. But to have a definitive view of what these are usually requires a fine needle aspirate, which means we take a needle and put it into the growth, and then we can draw out a few cells. And usually people, when they see that, they think, oh, you didn't get anything because we didn't get fluid or a bunch of stuff that comes out of that. But we don't need that. We just need a few cells, and that would actually just be in the hub of the needle that we put into the growth, and then we can put that out on a slide. We can stain it and we can look at that, and usually from looking at the cells we can get a much better idea of what we're dealing with, and that way we can decide how we need to proceed with treatment. Do we need to remove these surgically? Do we need to be very aggressive with these because it looks like it may be something malignant? Is it something we can deal with conservatively, treat with medication and try to shrink them? So several different ways to deal with that after we've done the fine needle aspirate. Now sometimes those needle aspirates require something more specific or specialized, which means we'll send it to a pathologist and let a pathologist look at it for identification. And so that will help us along in our way to decide what we've got. And then when we do decide, a lot of times that is surgical removal because we want to remove those growths. And that can be done in different ways. We do have, for smaller growths that are more superficial, we have our cryotherapy, our cryoprobe, which is a freezing liquid nitrogen type treatment that we can use that can freeze them off, just like if you go to your dermatologist, they may do that. And we sometimes, if they're small enough and on a location on a pet, we can use a local anesthetic and remove them without complete general anesthesia. But a lot of them, especially depending on where they're located, if it's around the dog or the cat's head or foot, that you're not going to be able to keep still while you're operating on them, then you do want to sedate them or put them under general anesthesia to remove those growths. And so that's how we deal with those. And it is good, I mentioned about the fine needle aspirate and understanding what we've got. We want to know as close to we can what we're dealing with before we go in there, because certain ones, if they're more likely to be malignant, we want to take wide margins around that, because there are certain types of tumors that is curative, even if it's cancerous. If we get wide enough margins around the growth and remove that, and then there's none of that tumor left behind to come back again or to spread to a different part of the body. So that's where that information before surgery comes in hand. Let me say this too about cats. I'm speaking mostly about dogs, but cats do get skin tumors as well. They're not as common, but the thing about cats is that 70% of skin growths on cats are malignant. So that's not the case with dogs, and most likely not the case with humans. I'm not a human dermatologist, so I don't know that. But so if you see a growth on your cat, you need to get that checked out. The sooner the better, because a lot of those types of tumors, time is of the essence, because if you remove them sooner, they have less of a chance to spread and send their tentacles out into the tissues to become embedded in the surrounding tissues, which would make them harder to be removed. So keep that in mind with cats as well. So that's some information about skin tumors, growths, lumps and bumps, and if you see something like that on your pet, need to get that checked out as soon as possible. Maybe nothing major to worry about, but you need to know that, and especially, as I said, if it's a cat. So thank you for your time, and we'll see you next time.